Measles is back in Colorado like it hasn't been in decades. The entirely predictable consequence of vaccine misinformation and hesitancy. As more measles cases pile up connected to Broomfield High School, our Spencer Soysher looks at how historical outbreaks in our state actually helped researchers develop the effective vaccine schedule that's now under attack.
Measles outbreaks, like the ones tied to schools in Broomfield, are sort of new. New because until 2025, we hadn't had more than 2 measles cases in a year in Colorado since 1996. 36 last year, 8 already this year.
One of the changes that was made during the 90s that really did lead to a decline in measles cases and eventually measles elimination in the US, which was achieved in 2000, was adding on a second dose of MMR vaccination.
State epidemiologist Dr. Rachel Herlihy knows about Colorado's history of measles outbreaks before a second dose recommendation was added. We went into the 9 News archives to see what was in the news in 1988. That's when 84 cases of measles were identified at Fort Lewis College in Durango, a campus that required vaccination.
Obviously, I haven't spent probably as much time in the archives as you have, but yeah, familiar with that one.
CDC researchers found 0 cases in students who had 2 doses of the measles vaccine after they were a year old. The CDC formally recommended 2 shots of the MMR vaccine the following year.
So I think that did make a difference in boosting the level of immunity in communities and adding some protection.
But in 1994, 247 people contracted measles after someone infectious was at Breckenridge Ski Resort. The state said 61 cases are traced back to Colorado. By 1996, there were never double-digit measles cases in Colorado again, until this past year.
We have seen, like the rest of the country, a decline in MMR vaccination rates.
Colorado has one of the worst measles vax rates in the country, and 91% of Colorado kindergartners have gotten at least 1 dose of the MMR vaccine. That's below the herd immunity threshold of 95%. Health officials recommend that children receive 2 doses, with the first dose between 12 and 15 months old and the second dose at 4 to 6 years old. And infants traveling internationally should receive one of those early doses between 6 and 11 months old. Kyle.
Well, if anybody was curious what it was like to live in the past, we're getting a little taste of it, at least when it comes to epidemiology. Spencer Soysher, thank you.